Hey there, Medicare Joe here again, and today we're going to be going over what is Medicare and who qualifies as part of our Medicare Basics series. In this short video, I'm sure a lot of you have probably wondered, what is Medicare anyway, and who qualifies? Today I'm going to break down Medicare, the A, B, C, and D of Medicare, what that all means, how it all fits together, and we're going to keep it easy as part of this Medicare Basics series. So to start off, what is Medicare? Medicare is a federal health insurance program, and most people qualify for Medicare when they're turning 65, they're aging into Medicare for the first time. Although you can also get Medicare if you've been on Social Security disability for 24 months. So if you're under 65 and you're younger, you can actually still get Medicare through that qualification of being disabled and on Social Security disability for 24 months. That then qualifies you before the 65th birthday. For most folks watching this, it's going to be when you are turning 65, you become eligible for the federal health insurance program. And really what this is meant to do is it's meant to act as a easier, more affordable way for seniors to be insured past the age of 65 when they retire. When we think about Medicare, it's a complex topic. There's a lot of different moving parts. There's many different options that you can pick. And it's important to have an understanding of what the parts of Medicare actually are. So Medicare is made up of 4 parts, and not every part is Medicare, which I know can be confusing. One of the parts is actually an alternative to Medicare. So to dive on into it, your first part is Part A. And Part A is going to be your hospital coverage. So if you think about your inpatient stay at the hospital, skilled nursing care, hospice, everything that requires an overnight type of care inpatient is going to be Part A, also known again as your hospital insurance. Now Part B, I like to call it everything else, but Part B is your medical insurance. So this is going to be like your doctor visits, outpatient services, surgeries, lab work. Anything that is done outside of just a hospital stay is going to fall under Part B, which is your medical insurance. Again, I group it into the everything else category. Now, Part C is when everything kind of has a wrench thrown into the whole mix here. Part C is what is called Medicare Advantage. And what this is, it's an all-in-one alternative option to choosing original Medicare when you get on to Medicare. Ultimately, it's run by private insurance companies, so you're still eligible for your Medicare, but when you choose Part C, you're giving up the insurability to be insured by a private insurance company instead of the federal health program. So Part C, although it's a part of Medicare, it's not actually Medicare when you have it. You're actually choosing the alternative option to Medicare when you have Part C. And then lastly, Part D is going to be prescription drug coverage. So this can be more or less a standalone policy, or this can actually work with your Part C of Medicare. It's mainly though just to cover your medication costs. So prescription drugs fall under Part D. So again, you have Part A, B, C, and D. Those are the parts of Medicare. They all have something to do with Medicare, but they're not actually all a part of the federal health program. In this video, I want to touch on though also those 2 parts. So original Medicare is one option. That's Part A, B, and Medicare Advantage is Part C. So again, just to distinguish the 2 as being different, and I'll have another video here shortly walking you through a more in-depth comparison of the 2. Original Medicare Part A and B, this is run by the federal government. You get to use any doctor or hospital that actually takes Medicare. You're not insured by a private carrier. It does not include drug coverage. That's why you have to add the Part D with this option. And this option is often paired with what's called a Medicare Supplement plan or a Medigap policy. So again, original Medicare is one option, that's Part A and B, with Part D as your drug coverage and typically adding a Medicare supplement with it to fill the gaps. The other option is Medicare Advantage. So Medicare Advantage is Part C, which we just said. What this does, it becomes an all-in-one program. It combines your A, your B, and your D, and it puts it all into one plan with one carrier, private carrier typically. And it's going to have a summary of benefits that you're typically familiar with from your insurance you've had all along here. You're going to have co-pays, you're going to have networks of doctors, you're going to have out-of-pocket maxes. It can offer much lower premium than the original Medicare side, but it does come with more restrictions because of that. Now, which one is better? That really depends on your needs, and we're going to cover that, like I said, in another video to go through the pros and cons of each one. So for this Medicare Basics series video, we talked about what is Medicare, who qualifies, the different parts A, B, C, and D, and a little brief overview on original Medicare versus Medicare Advantage. In our next video, we're going to dive into Part A, hospital coverage, and really what that actually covers when you break it down and really get to understand it. And if you're turning 65 or you're helping a loved one through this, feel free to drop a comment or ask a question below. We're happy to help you through the process of making this more simple as you go through our Medicare Basics series here. And if you found this video to be of value, hit that like button. And if you'd like to join our channel and be notified whenever we post new YouTube videos, that's what that red subscribe button does in the corner. You can subscribe to our channel, and every time we post a new video, you'll get a notification that it's up. Thank you for watching as part of today's Medicare Basics series.